appreciate the office of the RDC and the office of the chairman for the district aids committee, Mr. Jafari Abasajabaraba, and the office of the CAO who have organized this function, specifically to give an update on how far we've gone. Mine is to give a technical brief, and before I start off, it's important to notify you that as of Bushenyi District, the current HIV prevalence is at 8%, meaning that out of every 100 people we see, 8 are testing HIV positive. And this is way above the national average, which is 4.9%. So this is, of course, a concern for us, and we've so far tested and identified about 95% of the people we think are HIV positive. The estimates for this district show that we have about 18,172 people who are HIV positive. And we have about 879 who are still out there. They have not yet been known. So they have not yet known their HIV status. That's why we are moving out as one of the engagements to do HIV testing. And of those we have tested, we've linked them to HIV care. And so far, we have a total of 17,293 people living with HIV/AIDS and on ARVs. So they are being treated and managed through our health centers, and we thank the government for that. And in terms of viral load suppression, we are so far at 97.2%, implying that the people I've talked about as being on treatment, 97% actually having viral load suppression, which is very important for us in the fight against HIV/AIDS. Briefly, what is causing what we've seen as the risk factors in this district is to do with one, the rise in infections among the adolescents and young girls, and generally when you look around Bushenyi district, we have several institutions, universities, and institutions of higher learning, and we are seeing among the ones we test, those who are testing positive, majority are students and young people. So we think there's action we need to take in relation to that side. Secondly, we have several groups of people, the tea plantation workers, the uniformed and others. So we want to see how we engage them more in this period. We have several truck drivers, as you know, this is a highway to Congo, and so we have several people who go through this district and other visitors into the district, especially those who come for the different markets that are popular in this district. But not forget the several bars and lodges that we have in several of these hotspots that we've identified. And just to mention, the hotspots we have in this district are mainly around Ishaka, around Akashanda, around Lentuha, Mashonga, Utare, and Chizinda. That's where we are seeing most of these infections, the new infections. And when you look at the percent there, it's actually more than the average for Bushenyi. In most of these hotspots, we are finding it at 9%, which is above the one for Bushenyi, which is 8%. As a district, of course, we've set out various measures working through the DAC, and I'm sure our chairman DAC is going to talk about them. But just to mention that we want to use a multi-sectoral approach, and that's what we're already doing. We're using a multi-sectoral approach in working with different departments in this district and different players and stakeholders to make sure that we curb the new infections. In terms of the update in relation to this function, we've so far held various radio talk shows across different stations from Kampala, Mbarara, and in Bushenyi. We've also had TV shows on various televisions, various media, and that's from the national up to the district. We also plan to have more radio talk shows, and we are already running DJ mentions and